base with him. We shall be going back to him now. You may have used herbal rather than conventional medicines at some point in life to treat certain ailments, or maybe even know someone who swears by the miracles of medicinal plants. Well, experts say with half the world's population lacking access to essential services, the need for alternative medicine has never been greater. Given this growing demand, the world is increasingly embracing traditional medicine in health systems. On this episode of Health Digest, Gloria Mulimu looks at how countries across East Africa are working towards the integration of traditional, complementary, and integrative medicines into their national health systems.
In remote and underserved areas, healing does not begin in the hospital corridors, but in forests and fields. Traditional and complementary medicine is often not an option, but the only care within reach, available, affordable, familiar, and trusted. While many populations rely on these medicines for care, the use of herbal, complementary and integrative medicine is not fully optimized, as the services remain outside the health system. However, due to the growing demand for meaningful care, the need to integrate traditional medicine into the modern health systems has never been greater.
Nishawahi tumia dawa za kienyeji na zinasaidia sana. Zimesaidia hata babangu pia akiwa hai, na pia mimi natumia kama mwarobaini.
Nilipokuwa na homa kiasi nilipewa mwarobaini nikatumia na ikanisaidia kupoa haraka.
Nilitumia dawa za kienyeji kutibu dengue fever na ilinipeleka vizuri sana. Juu hata sikumaliza hata siku 3 nikawa nimepona.
How to ensure strong national policies that will help promote the key role traditional and complementary medicine plays in improving health and well-being is a discussion that convened policymakers, researchers, and stakeholders in this space in Nairobi this week to also deliberate on how to preserve this indigenous knowledge in a safe and regulated manner. How to craft bold national policies that recognize and elevate the vital role of traditional and complementary medicine in advancing health and well-being took center stage in Nairobi this week.
Today we are not debating whether traditional, complementary and integrative medicine exists. We are deciding how it is strengthened, safeguarded, and responsibly integrated.
For us to integrate herbal and traditional medicine into the mainstream healthcare system, then we need to have evidence. We need to show that they are safe. We need to show that they are efficacious. And we do this through various platforms where we have what we call in vitro systems and in vivo systems. Then we have the clinical systems which also help us provide this information.
Across Africa and globally, traditional and complementary medicine continues to play a vital role in primary health care. It is more than a form of treatment. It's a cultural identity, heritage, and a safety net for millions from underserved areas.
Nikutana na bwana mmoja akanipa baadhi ya matibabu, nikatumia, nikarudi tena kwake akanipa miti mingine, mizizi, akaniambia chemsha hii. Kwa kweli nafuu na hiyo.
Ni blueprint ndio ambayo nimetumia kwa muda mwingi kiasi mpaka mwishowe nikashauriwa kwamba hii si kitu ya kuitegemea. Baada ya kunishauri ndio akanielekeza kwa kutumia vitu ambao ni matunda fulani na mboga fulani ambavyo huwa vinaregesha katika hali ya upande wa nguvu za kiume.
It is not just a mere alternative system of medicine. It is often the first point of contact with the system for many.
For the last 20 years, I've been admitting patients, especially NCD, those ones who have come out of hospitals with no hope. They come to our center and we have given them traditional medicine.
daktari akimprescribea mtu madawa, mimi namprescribea vyakula fulani, matunda fulani na mboga fulani.
While 80% of the population in Africa seeks traditional medicine or healers, experts warn that only 1% of health and research investment is pumped into this sector.
The question before us, as Dr. Nima mentioned, is not whether the traditional medicine should have a role in our health systems, but rather how we can ensure that it is integrated in a safe, evidence-informed, equitable manner and is aligned with the national health priorities.
Integration without regulation risks harm. Regulation without recognition risks marginalization. And recognition without evidence risks stagnation. So we must strike a balance.
In March 2025, the World Health Organization launched the Global Traditional Medicine Strategy for the year 2025-2034. The framework provides a structural global agenda that seeks to strengthen the policy and regulation framework for the integration of traditional, complementary, and integrative medicine for member states.
We need to integrate this into the health system. We need to do more research, and we need to regulate the medicines so they're safe and effective for the people that are using them.
We have taken a deliberate and a very structured approach to embed traditional medicine within our broader national health agenda. Our progress is anchored in policy development, which we are now doing it, a clear research framework, and the development of practitioners' handbook.
While the WHO policy has been adopted by these states, including Kenya, its implementation remains uneven. A concern that the first East African Forum on Traditional, Complementary and Integrative Medicine sought to address this week.
While policy foundations are increasingly in place, the pace and the depth of implementation vary across different countries. And this reflects the differences in capacity, in institutional arrangement, and in the maturity of their regulatory bodies. This diversity should not divide us. It should strengthen us, should give us or present us an opportunity for more deeper collaboration.
Experts say traditional medicine is not just a gap filler for where conventional medicine does not have all the solutions. It is an opportunity to bring the two health areas together in a mutually beneficial way, especially at a primary healthcare level, to support universal health coverage. Gloria Milimu, KTN.
Thank you, Glory, for that report. Remember, that comes to you every